name's Kayla Campbell. I'm a student nurse here at the University of South Alabama, and today I'm going to be performing a nasogastric tube insertion. Here's my ID, and I'll scan the room. I will now place my phone. And so I begin by checking the order form, which I have right here, in the hospital policy, and the order says that I am going to be inserting a Salem sump and connecting to low intermittent wall suctioning. So now I'm going to identify the patient using two identifiers. So here we have Jaguar Jones, medical record number 4176352, medical record number 4176352, and unknown allergy to penicillin, both here on his wristband and on his chart. So I'm going to set this aside, and I'm going to go ahead and gather my equipment, or before I gather my equipment, I'm going to provide privacy for the patient. And Mr. Jones, I'm going to be inserting a nasogastric tube today in your nose, or through one of your nostrils. And so now I'll go and gather my materials needed, which I have right here. And then I will apply goggles and perform hand hygiene. So now I would go on to raise the bed to an appropriate working height and lower the side rail. And I would assess the patient's, excuse me, I would raise the bed to an appropriate working height, lower the side rails, and assess the patient's vital signs, O2 saturation, and bowel sounds. And so I'm going to put my pulse oximeter right here on the patient's finger. And I want to go ahead and note that if the patient's O2 saturation drops, or if there's a change in the vital signs, I would stop the procedure and then continue once the patient is stable. So, excuse me. And so from there, I would raise the bed to high Fowler's position. And Mr. Jones, if you want me to stop this procedure, please raise your hand so I know. Okay? And so now I would prepare all of my tape, which I have right here. I already prepared it. And then I would open my NG tube packaging and apply a water soluble lubricant, a big dollop of it right there. And then I will go ahead and apply a clean pair of gloves. I'm going to test the patency of each nostril, so I'm going to occlude it and ask the patient to sniff. Occlude the other one and ask the patient to sniff. And now I'm going to take an alcohol swab and wipe the bridge of the nose and let it dry. And I would now measure my NG tube on the patient, going from nostril to earlobe to xiphoid process on bare skin, not over clothing. And I have this in a separate video for you, so I'm going to go ahead and take my dog-eared piece of tape and just put it where I will be stopping. Okay, I'm going to set this back down. And now I'm just going to lie down a towel, my basin, and the water. And I'm going to grab my tube, make sure it's nice and lubricated. And the patient will be head back against the pillow right now. And I would go ahead and I would insert it, going back towards the ear. And once I reach the nasopharynx, I would ask the patient to tilt their head forward a little and take sips or swallows of water continuously as I go 1 to 2 inches down at a time, 1 to 2 inches inserting at a time and twisting it 180 degrees. So And I'm going to go ahead and secure this temporarily with a piece of tape on the cheek of the patient. And so now I'm going to take my tongue depressor and pen light, and I'm going to make sure that the tubing isn't coiled in the back of the throat, which it is not. And now I am going to verify the placement of the NG tube, and the gold standard to do this is using an X-ray, or I could aspirate gastric contents from the tube right here in a 60 milliliter syringe. And the third way would be to aspirate the gastric contents and test the pH. And so now that I have verified the placement, I'm going to go ahead and attach or put on the permanent securing for the NG tube. So I'm going to remove this piece of tape right here and apply the permanent piece. Remove the temporary. And I'm not quite sure if I mentioned this or not, but I would have, when I took off the dog-eared tape, I would have marked the tube with a permanent marker to make sure that you know where it is supposed to be inserted at. And this is my label, and I would have the date and time on here of the insertion. And I just put it over top, the other on the bridge of the nose. I would attach this tubing to the gown, leaving a little bit of slack so the patient's able to move. And I'm not sure if I mentioned this earlier, I do not believe I did, but during this insertion process, if the patient had any respiratory distress at all, I would have pulled the tube back to the nasopharynx area and then waited for regular breathing, and then I would have continued with the procedure. So now I'm going to connect the tubing to low wall intermittent suctioning. And so this is my suctioning tubing, and I'm going to insert it into the clear part. And then I would turn on the low wall suctioning to whatever the order says. And if I was not using the suctioning, I would cap this tube like that and make sure that this blue pigtail does not go below the stomach. Trying to get a little unwinded. So that's there. And now I would clean up my supplies. And I would lower the bed and raise the side rails, making sure that the head of the bed does not go lower than a 30-degree angle. And I remove my gloves and perform hand hygiene. And then I would go on to document this, and I would document the type and the size of the NG tube. And so I have a Salem sump and a 14 French. I would also document the securement method, which is tape. I would document the verification method, which was an X-ray. I'd document the location and the time, and so the location's in the patient's right nostril. And then I would also document how the patient handled the procedure, and I would also document how any secretions and the characteristics of those secretions, such as the texture, the amount, and the color, and the consistency. And so now I'm going to go on to the discontinuing of this NG tube. And so what I do first is, of course, check the order and identify the patient using 2 identifiers. And I'd have this towel down on the patient's chest. I'm going to perform hand hygiene and apply clean gloves. And so now Mr. Jones, I'm going to tell you that I'm removing your nasogastric tube today, and I would assess the bowel sounds, I would unclip the tubing from the patient's gown, and I would tell the patient to take a deep breath and hold it, and then I'm going to remove it. So take a deep breath and hold it, and I'm going to remove the tube swiftly and dispose of that. And then I would perform oral hygiene on the patient. I would perform oral hygiene on the patient, and then I would remove my gloves, perform hand hygiene, and document the procedure. And that completes my NG insertion video.